And so we're so elated to have each and every one of you tune in. And this is an opportunity where you get to hear all things about brain health and how to age well. We have lots of resources that we share with you each week, but we're also featuring various faculty and staff who are conducting research around brain health. So it's important now that you grab a pen and paper so you can take lots of notes. And as you know, each session is being recorded. So you can always tune into our YouTube channel and click on the link to watch any of our previous recordings. All right. So stay tuned for additional announcements. But if you're new here, I want you to go grab a sturdy chair. Why? Because we kick off every program with exercise. Yes, we say what's good for your heart is good for your brain. So you must be active and moving and getting that heart rate up. And so John Lewis comes on with us before every program, and his enthusiasm comes through the screen. So we're just so excited that he's able to join us every week. We're going to drop information on how you can connect with John beyond BrainTalk Live. But remember, you need to go at your own pace. You can go faster than John. You can go slower than John. We just need you moving, okay? All right, so with that, I've done all my housekeeping, but make sure you use our Q&A function and the chat function if you have any questions or comments that you want to share with our presenters today. So after John Lewis, you're going to hear from Dr. Monica Parker and then Dr. Amy Rodriguez, okay? All right, thanks for tuning in, and we'll see you back here after you've got your heart rate up. Welcome, John.
Hey, hey, hey. First of all, I want to say thank you for coming. And today, if you have a stick, a cane, a broomstick, anything you have around the house that's straight line, and if you don't have it, just watch my arms at all times, because we're going to body sculpt, but also work on that core. But the broom is going to keep great form and great posture. So get your stick right now. In 5 seconds, we're going to get ready to go. Here we go. 5, 4, 3, 2, and 1. All right. Both hands straight ahead. And we're going to turn. We're going to get that rotator cuff, that chest, and side obliques. Let's go. 1, 2. Remember, if you don't have a stick, just watch my arms. And good. Both on both sides. You're getting a nice stretch. You're getting those lats, those shoulders. Great. Wide behind. Turn. Don't overarch your back. Chin up. Good. Bring your arms up. Level, hands straight, and twist. Don't move those legs. Tilt forward. Remember, if you don't have a stick, it's okay. If you don't have a broom, it's okay. And good. Great. Bring it up. Straight line. Turn. 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 And great. I want you to cross your arms, elbows up, and twist. Let's close our legs. Good. We're working good core, good side obliques, and we're working those abs. Good. Arms straight up. Feet wide. Tilt. Chin up. There you go. Rest. Sweet. Good. Switch hands and let's go. There we go. Rest. With the hitter. Watch my hands. Great job. Turn that waist. Chin up. Great job. Switch hands. Great job. Hands out in front. Arms straight. Chin up. Turn your waist. Great job. Great job. All right. We got to get those abs right before Thanksgiving. So let's get it. Here we go. Come on. Give me that waistline.
Before I go to work, let me do
Come on.
something that's gonna keep me on the line.
Come on. We got to drop some inches before Thanksgiving because I know y'all going to enjoy yourself. Come on now. There we go.
So before I hit the door, go chase the dough. Let me get you somewhere that's gonna keep me on the mind.
There we go. Come on.
Whatever keep me on your mind.
Keep that waist going. There you go. Okay. Keep it going. Keep it going. Keep it going. Hey. There you go. Keep that waist. Come on. There we go. Come on and keep that weight going. Go. Come on. Turn it. Turn it. Turn it. Turn it. Turn it. Rest. Good job. We gonna keep it going. Now we're gonna get those hips. Then we gonna get that waistline. Here we go.
I can't help but win. Can't help but win.
Come on.
Check it out.
Watch it.
I see you with him. He ain't right, but you don't trip.
There we go.
I stand by.
Then we get those hips.
And turn
There we
around and forget.
Go.
Can't take to see your face. Those tears run down your cheeks.
Keep it going.
What can I do? I gotta stay true. Cause deep down I'm still a
Watch
G.
now.
And I don't wanna come between you and your
Get them
man.
Come on.
Though I know I treat you better than he can.
Come on now.
I can't help but wait till you get back with him. It don't turn
Get them arms up. Get those arms up now. Hey.
with me, the same.
Come on. We can still get that waistline.
Baby girl, you are the star, and I can't help but say, impressed. You just let him call
Come on.
shots. You're the queen, you should be getting all that someone's got.
There you go. Come on.
Rocking the latest
Hands down.
I see you worth much more than vacation. Oh, I love you. I'm thinking of you.
Bring it back
I
down.
wanna come between you and your man.
Come on now.
Even though I know I treat you better than he can.
Come on.
Girl, I can't help but wait until you get back with him. It don't change what words.
Come on.
See that with me, it doesn't.
Come on. Come on.
Feel you, see you, for what you really are. Baby girl, you are a star. And I can't help but
Everett.
get it together.
Great job. We're going to keep it going. We're going to keep it grooving. Here we go. We're going to stretch a little bit. We're going to start right here in the butterfly. Come on now. We're stretching that lower back. Those hips.
See you shine in the night like a diamond.
Press. Feet wide. Feet straight. Gonna go left to right. Let's go. Come on. Come on. Give me them shoulders. Woo. Come on. Come on. Come on. Woo. We're gonna hold this one. Hold it. Hold it. Hold it. We loosening that back up and them shoulders. Switch. Oh. There we go. Keep it going. Roll it. Roll it. Bring it to the middle. Come on. Come on. Come on. Watch it.
Say what you find, I swear when nobody's around.
Now, I don't want you still. I want you loose. Loose now, loose. There you go. Watch this. Bring the leg up. Now I'm really isolating them abs. Come on. Oh, switch, switch. Oh. Watch this, watch this.
Nothing feels better than this.
Hold that foot up. Switch. Bring it back. Come on. Loosen up. 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 Come on. Oh. Here we go. Can we get some more of those abs? Go. We get the front abs, the side obliques. We get the mid and lower abs. Let's go. Come on now. Come on now. Come on now. Okay, just sit. Rest. Y'all ready? 5, 4, 3, 2, and 1. See you later, bye. Hey, go tell a friend to come on and not only get the knowledge, but come on and see me and just move your body and let's get loose.
Woo! Bravo, bravo. Thank you again. That is John Lewis. We're going to drop all his information in the chat so you can connect with him beyond his weekly feature here with BrainTalk Live. You got a good stretch in, everybody. You got some great tips on how to stay active until Tuesday. Yes, John, you're right. That what's good for the brain is good for the heart. I hope you guys were moving. Give John a big shout out and a thank you. We appreciate him. And that enthusiasm is contagious. All right. So welcome back, Dr. Parker. We were away last week, but we are back and glad to be back. We were missed, I see, because I got a lot of emails, a lot of comments like, where are y'all? But we're back. Tell them what they missed last week.
Well, you missed an awful lot of information about how you can stay healthy, how you can keep your brain healthy, and the sorts of things that make life worth living are the things that make it healthy for your brain to be here. We learned from Dr. Bennett that one of the things that's important for you to do is reduce the stress that's in your life. So when we talk about stress, stress raises our blood pressure. He was kind of very zen and wanted to say anything that upsets you, anything that's disturbing to you, you need to get it out of your life, because that's one of the risk factors for shortening life expectancy, but more importantly, increasing your risk for dementia. He also talked about sleep, how important sleep was and how important it was for people to make sure that they got adequate sleep, because this is what the nun study, or the religious order study that he conducted over several years, was able to learn. He also told us that the nuns in this religious order study had a very simple, very basic kind of life. They had something purposeful to do. They had a routine. They had regular activities that were both social, but also physical. They also indicated that they had a very simple diet. Those were the things that Dr. Bennett told us. Dr. Law let us know that where we are with respect to research and brain health and cures and treatments, that a lot of the research now is focused on what we can do to prevent dementia, because we haven't yet come up with a definitive cure. There are several different medications called monoclonal antibodies that are in development, but only one of at least 10 that are in development has been approved by the FDA. You probably watched the news last week and you heard that Eisai, E-I-S-A-I, a pharmaceutical company, has another monoclonal antibody, lecanemab, that's they feel is ready to get FDA approval. And if it gets FDA approval, it will be available to medical providers to administer to you. The caveat with all of this is you have to be sure that what you have is actually Alzheimer's and not some other dementia. These monoclonal antibodies, these medications that are currently being discussed and getting ready for market are only for people who have Alzheimer's. And if you've been paying close attention to us, you know that there are several different types of dementia. Alzheimer's is the one that is most common. But if you have a dementia that's related to chronic alcoholism, this is not the drug for you. If you have a dementia that's related to chronic head trauma, chronic traumatic encephalopathy, these medications are not for you. If you have dementia related to strokes and cardiovascular disease, these medications are not for you. I'm saying that because it's very important for us to get the accurate diagnosis for what type of brain dysfunction you have. All brain dysfunction is not Alzheimer's, as you're aware. And so when you need to have this kind of evaluation. In the meetings that we have had with many of you who come to our programs, it's like, well, why does it take so long to get an evaluation? Well, to get an evaluation, it's a process that involves your family physician or your primary care physician. It involves a neuropsychologist, that's a PhD doctor, a non-medical doctor. It involves the neurologist, the MD doctor, who puts together the information from the primary care physician and from the neuropsychologist to help us understand the type of brain dysfunction you have. And once you go through that process, if it is confirmed, usually right now, the only way we confirm it is with an amyloid PET scan or with cerebrospinal fluid that needs to be analyzed for protein precursors that are aligned with Alzheimer's. These proteins are something called A beta proteins. They're also called tau proteins. Different types of dementia have different kinds of metabolites or findings in your cerebrospinal fluid. But for Alzheimer's in particular, you have to have specific, what we call biomarkers, either in your cerebrospinal fluid or on your amyloid PET scan that indicate that what is causing your problem with brain function is indeed due to Alzheimer's. So that's why it's important for you to make an appointment first with your primary care doctor so that that doctor can rule out the things that need to be fixed, that need to be addressed. And then we can get you into a pharmaceutical trial if that's something that you're eligible for and appropriate for you. But one of the things that Dr. Eliza Wingo talked about last week was mood and purpose in life. And this was something that the women and the men in the religious order study had. Their purpose in life, their religious order, their faith, dedication to their faith was their purpose in life. So if you have a reason to get up in the morning, that's a good thing that helps preserve your brain. It doesn't have to be a job. It can be dedication and service to your family. It can be dedication and service to your community. It can be anything that you find purposeful and enjoyable, because these are the things, to be cliched about it, these are the things that make life worth living. So having purpose in life was one of the things that Dr. Wingo talked about. Dr. Wingo is a psychiatrist, and she studies resilience, cognitive resilience. What are the things that keep people's brains healthy in spite of anything that might be negative? And those are some of the important things that she talked about. And finally, Dr. Alan Levy, who is director of our Goizueta Alzheimer's Disease Research Center, talked to us about the role of precision medicine. As research progresses, regardless of the disorder that we have, our genetics and our biologic makeup may better determine what therapeutic interventions are most appropriate for us. So we have ongoing studies that are in this field of research that have to do with Alzheimer's. But more importantly, precision medicine is something that's being used to manage people who have things like cancer, breast cancer, colon cancer. There are personalized kinds of things that we're working with to help better understand how disease manifests and how better disease can be managed by making it personalized. We analyze your genes and other things. So that's a developing science that we're working with and pioneering here at the Goizueta Alzheimer's Disease Research Center. But this kind of precision medicine, looking at different diseases and the genetics or the biologic underpinnings of different diseases that are unique to the individual, are ongoing in other specialties other than neurology. They're present certainly with respect to different types of malignancy. They're present with certain sorts of, what's the word I'm looking for? Infectious diseases. So stay tuned. I like to say we want you to participate in our clinical research here in the Alzheimer's Disease Research Center. But if you're not interested in Alzheimer's, please go to the clinicaltrials.gov website or researchmatch.com and find research, clinical research that you are interested in that is applicable to you and you would find useful. All research participation is voluntary, and it can't help but make you a better consumer of healthcare and a better consumer of information about how you need to better take care of yourself. So partner with your primary care doctor to get the kinds of questions answered that you want answered. Find out about research studies. Observational doesn't mean that we're giving you anything. We're just observing how you live. Become a part of our Emory Healthy Brain Study. That's one of the things that we're doing that's preventative, and you can be in a prevention study, and you can be in an observational study, and you can be in a treatment trial. You don't have to be in just one study and not anything else. So with that, I'm going to turn this part of the program over to our second presenter, Dr. Rodiguez, who is a PhD doctor who specializes in movement, and she's in charge of what we call the Cognitive Empowerment Program, something that we're learning in her research, and she'll tell you more about it. We're learning how to help people who have memory impairment live with those impairments and enjoy a better quality of life. So at this time, I'd like you to meet and hear from Dr. Sandra Rodriguez. Amy Rodriguez. I'm sorry, Amy.
That's
I know who you are.
yes, I know. Well, thank you so much. It's a pleasure to be here today. I want to make sure that y'all can see my slides, so I'm going to pull up my screen here. And we'll start from the start. You can see it. Okay, so again, thank you so much. It's wonderful to be here. I am Dr. Amy Rodriguez by training. I am a speech language pathologist and rehabilitation scientist. And I work at both Emory and at the VA. And my work at Emory is, as Dr. Parker mentioned, in the Cognitive Empowerment Program. And at the VA, I do research with people who've had strokes, who have language and cognitive impairment after stroke. And so what I'm going to talk to you about today is something called supported communication for individuals with language impairment. But I want to preface by saying why, by telling you why this is important for brain health. And we've just heard about, all of the speakers last week who talked about how important it is to be socially engaged and how good that is for your brain. And so sometimes when people have language impairment, one of the things that happens is they become more socially isolated. So we all have an opportunity to contribute to other people's brain health by supporting communication. And so that's what I'm going to talk to you about today. And so I'm going to introduce the term aphasia. Some of you may be familiar with it, but others may not. So aphasia is just the name of a language disorder that can affect speaking, understanding, reading, or writing. The most common cause of aphasia is stroke. And that can be either a brain clot or a brain bleed. But difficulties with language or aphasia can also result from traumatic brain injuries, from tumors, from brain infections, and then also from progressive brain diseases like dementia. And as you can imagine, communication is such an important part of everyday life that, like I mentioned, it does have an impact on social engagement, but as well as impacting, people's identity and relationships when they have difficulty communicating. So it's really important to think about different ways that we can help people with communication. And supported communication is a training approach that has been developed and can be applied for people with language impairment like stroke aphasia. But it also can work with people who have cognitive impairment, who have limited English proficiency, and even people who have hearing loss, because this is just a way of meeting people where they are and finding ways to get around the impairments that they have using different approaches. So we think about all of the different ways that we can communicate and bring forward to a conversation the ones that will be most helpful. So supported communication for adults with aphasia is a specific program that was developed at the Aphasia Institute in Toronto. And so I'm going to talk about the principles of SCA. But one great analogy that has been used for this program is that it's a communication ramp. So if we think about our physical world, and we think about, for example, when you're taking a walk on the sidewalk or you need to cross the street, there are curb cutouts. And so those are making it possible for people with a physical disability to be able to move in the environment. And so similarly, we want to be able to provide communication ramps for people to be able to communicate and be successful in a communicative and a social environment. So what I'm going to talk about today helps each of us be able to provide that ramp to other people to help them stay engaged and communicative. Okay. So some of the goals of supported communication are acknowledging competence and revealing competence. So the first one, acknowledging competence, is really respecting the communication partner that I'll call the other person a communication partner, and making sure that they know you understand that they are competent and that they have abilities that that you can help them sort of show in a conversation. Revealing competence is about helping get your message in to that person, helping them get their message out, and then verifying that message so that there's a common understanding about what's being communicated. So we will walk through each of these separately. So we'll start with acknowledging competence. So one of the most important things in a conversation is understanding that it's a two-way street, right? So there are two people communicating, and both people are competent, and they have, different limitations, right? Even those of us who don't have a language impairment have some limitations in communication. And so it's important to acknowledge your own limitations in any communicative situation, but especially when you're communicating with someone who has a language impairment. Communication breakdowns are going to happen. They happen in everyday life, even amongst people that don't have language impairment. But they are more common, of course, when you're communicating with someone who's got a language impairment. So it's very important to deal openly with those breakdowns. One of the ways that, and we'll talk about different ways to do that, but one of the ways to acknowledge somebody's competence is to say, I know you know, when it's appropriate to say that. And that means, that you understand that they're competent in the thoughts that they are, pulling together. It's just that they're having a little bit of difficulty in that moment being able to express them. When there is a communication breakdown, one of the things that's important is if different repair strategies have been tried and the person is continuing to struggle, just be flexible and willing to, drop the topic for that moment and maybe circle back. And so maybe you just say, oh, I'm having a hard time trying to understand exactly the point you're making, but maybe if we just take a moment and, circle back a little bit later, we can try again. And that just takes the pressure off. And it also says, hey, I have, some responsibility in trying to understand too, and I'm not able to understand. So let's try again a little bit later. It's important to be relatable. Like I said, we all have communication breakdowns from time to time. And so I think it's important to acknowledge that, but maybe avoid saying things like, maybe I have aphasia too, because we don't want to, kind of say anything in jest about, a condition that somebody has. Another thing that you can do to acknowledge competence is ask the person with the language impairment what helps them. So because impairment can look different according to where in the brain, somebody has a damage. And so maybe for one person, writing things down can help, but for another person, that's not something they're able to do. And so if you just ask the person what helps them, that's a great way to support their communication. And then in situations where you may be needing to get information and you're not able to get it from the person with a communication impairment, and you have to ask, their significant other or one of their friends, it's just important to ask permission if it's okay for you to ask somebody else a question, and to be inclusive. So this would look something like, hey, Mary, is it okay if I ask your husband about, your medical history? And then they may say yes. And then, then you would say, include that person in that conversation. So I'm asking about Mary's medical history and continue to refer to the other person so that they are not excluded from that conversation. Okay, and so then moving on, let's talk about revealing competence. Good ways to get your message in when you're communicating with somebody. So one big thing is to eliminate distractions. It's very difficult to have a conversation when there's lots of background noise going on. And so just a good, a best practice is to eliminate distractions kind of as a first pass. A second strategy is to use short, simple sentences. And that will be very helpful in the other person being able to process that information. Another strategy is to use an expressive voice, right? So there's many things we can do with our voice that convey meaning. So we can change the way our voice sounds to express different emotions. We can make sure that when we're asking a question, we make sure that our tone or our pitch goes up at the end. So did you feed the cat today? Right? We kind of change our intonation there to indicate a question. So there's a lot of things that we can do with our voice to help get that message in. Another thing that we want to do is make sure that we speak naturally. One of the things we tend to do as humans is when we feel like somebody can't understand what we're saying, we talk louder. But unless the issue is that there's a hearing impairment, talking louder is not necessarily going to help get the message in. So just use a natural speaking voice. And if there is a problem with the message that you're trying to communicate, you might repeat the message, but say it in a different way. And so that way, if it was just the way that you might have said it the first time that they didn't get, maybe on the next time when you say it a different way, it'll be easier for them to understand. So that's a strategy. The other thing we can do is use gestures. And so this is where we start to think about all of the different types of ways we communicate or modalities. So one of those is we can use our hands and gestures. So use gestures that are easy to see and to understand, and that can help with communication. Another thing that can help is writing down keywords or main ideas. So if you're talking with somebody and you're trying to get a concept through, you can write down on a piece of paper just the main idea. So I'm going to give you an example in a moment about trying to schedule a lunch with somebody, but just writing the word lunch down, if that's what you want to talk about, that might help get that person on the right track. Another great way to help get information in is through pictures. And so pictures can be a picture that you have on hand or even drawing. Some people can communicate effectively through drawing. So that's another way to support communication as well. And then finally, an important part is to observe the other person for cues. So sometimes people feel embarrassed that they don't understand, or they just may be trying to process something, but maybe something on their face or something with their body language tells you that they're having difficulty understanding what you're saying. And if you are observing them, you can tap into those subtle cues and then try a communication strategy that will help get the message in. All right, and so the other part of this is helping them get the message out. So again, providing pen and paper or pencil and paper can help, because if they're able to write down and that's a strategy that works for them, that will be helpful. Or if they want to draw something, that may also be helpful. Providing pictures is also a helpful strategy. You may ask yes/no questions. And if you're going to ask yes/no questions to help narrow down the message, it's very important to start general and then get specific. And that will just help that process go a little bit faster. You can also ask fixed choice questions. Do you want milk or tea? And then that helps narrow it down as well. If somebody's stuck in a situation where they're having trouble communicating and they're not using strategies, you can request clues. So you can say, can you show me what you mean? Can you describe it for me? Then that allows the person to remember that there are other ways that they may be able to try and communicate that. And then another important part is just to give enough time for someone to respond. So, we as proficient communicators are sometimes, kind of rushing through a conversation, or if somebody starts to have a little bit of a breakdown, we tend to jump in and start to try and fix it or say, do you mean this? Or, and that doesn't give them time to use their strategies and to reveal their competence as a communicator. So just patience and enough time to respond can really go a long way. Okay, so here's an example of getting information in and out. And so I'm just going to do a quick role play. So if I say to my communication partner, do you want to have lunch next week? And then they might say, yes, lunch. Monday, no, but Tuesday, I don't know. Then you might say, where do you want to eat? I know the place, that place, me and you before, the name, I can't. So I'm working now with what they've told me, a place we've eaten before. What kind of food? Cuban. Ah, buena gente. Yes. I love that restaurant. Let's take a look at your calendar so we can choose a day. So what I've done in that communication exchange is taken one thing at a time and say, okay, first let's decide where to eat. And when the person had a difficulty coming up with the name, what kind of food, right? That'll help me narrow it down. And then moving on to let's choose a day, and recognizing that they may have had some trouble trying to pick a day based on that first response, suggesting that we look at a calendar so that we can find a good time together. Okay, and then finally, revealing competence through verification. So reflecting is really just repeating the person's message. Expanding is adding in information that you think the person is trying to say to sort of expand. And then summarizing when there's been a discussion or, a couple of verbal exchanges, then just kind of pulling it all together. And this is really important so that, as I mentioned before, there is some verification that both people are in this conversation are sort of on the same wavelength. And I think this is a great quote. The single biggest problem in communication is the illusion that it has taken place. And if we don't verify, sometimes even in everyday conversations amongst people without language impairment, there are communication gaps. And so verification is just a really important way of doing revealing competence and supporting communication. Okay, and so let's just take an example of this: reflect, expand, and verify. And so now we're at the restaurant from the previous example, and I would say, how was your drive here? The car was long, it turned, and the lady said no, and then I turned, so late, sorry. No problem. It sounds like it was a long drive. Yeah. Maybe you made a couple wrong turns. Yeah. But your GPS helped you. Yeah. I got lost the first time we came here too. I'm glad you made it. So it's repeating back and reflecting what they've said, And then kind of, just being relatable, right? And that's just part of what we do as a good friend and a communication partner sometimes, is just to acknowledge when you've had some difficulties yourself. So that's a way that you can reflect, expand, and verify. Okay, so other good communication behaviors that I didn't mention yet, but are just good to keep in mind, is commenting. So commenting while someone is, talking is good. It's a way to show that you're listening, and it's a way to relate. But it's important to keep it short and relevant, because we don't want to get somebody off track by making a comment that can kind of get them going in a different direction. So commenting is positive, but keeping it short and relevant is important. Actively listening and giving good eye contact is also just a really good communication behavior. And then maintaining conversation. And so one of the things that can happen is sometimes people get lost in a conversation if it's moving too quickly, or the transitions happen without them realizing it. And so, introduce new topics and use transitions so that the person that you're communicating with can stay with you and continue to participate in a relevant way. Okay, so those are the main tips that we can all use to help support communication, which is super important for helping everybody stay engaged socially, for maintaining relationships. And I do research in aphasia treatment, not supported communication specifically. This was just some tips that I wanted to share with you today. But there is my email there if you have questions. And if you're interested in learning more about aphasia treatment research, I've included the name and contact for my study coordinator. So thank you so much, and I'm happy to answer some questions.
Dr. Rodriguez, after our BrainTalk Live, we have the Cognitive Empowerment Program. Can you tell people how that helps people with memory loss and how they might be able to access the program?
Yeah, absolutely. So each Tuesday after this meeting, there is the CEP, or Cognitive Empowerment Program, Community Live, CEP Community Live, very similar to this BrainTalk Live. You just join virtually right after this is over. And each week, one of the service providers from the Cognitive Empowerment Program does a talk or an interactive session. And I will tell you the different areas that we cover. So within the program, we do cognitive training, we do physical activity, we do classes on what we call living well. So adjusting to, changes in life. And so emotional coping, and talking about different lifestyle factors. We also talk about nutrition. So the mind diet, and, what's a healthy diet for your brain. And then we also have functional independence, which is all around making sure that you are doing things everyday type tasks like, cooking and cleaning and things like that in a safe way. And remembering that it's important to continue to do leisure activities, things that you enjoy in life. So those are the 5 main areas that we address in the Cognitive Empowerment Program. And each week, somebody is on to talk about or to do an interactive session related to one of those areas. And these are all the different areas that we call modifiable areas, risk factors, right? So being things that we can change about our everyday life that can promote brain health. So, staying physically engaged, staying cognitively engaged, and being socially engaged as well. And so that's what we're trying to promote. And that session goes from 3 o'clock to 4 o'clock.
Thank you, Dr. Rodriguez. I think Megan Nare is in the chat talking about what they're going to talk about today.
Yeah.
Functional independence and personal safety and how to avoid being scammed. That's what she has in the chat.
Wonderful.
Any more questions of Dr. Rodriguez? She gave you some great tips about communicating with people who may be cognitively impaired, keeping it simple, looking directly at them, making sure that you establish eye contact. That was good. Any more questions? Because everybody has asked us about providing communication techniques.
You see the one about communicating with someone with a hearing aid in the Q&A?
Oh, sorry. Let me just take a quick look here.
It's under Q&A now.
Yeah, got it. So are there additional suggestions for communicating with those with hearing loss who refuse to wear a hearing aid? Okay, so yes, I mean, I think that some of the tips that I talked about become a little bit more important in that scenario. One of them is eliminating distractions, and especially noise as a distraction. That will be one of the most important things. Another thing that's
Dr. Rodriguez, when you say noise is a distraction, can you kind of describe to people what that might be?
Sure. So sometimes, especially in a home environment, we'll have the TV on in the background. There's a lot of other voices talking, which makes it really difficult to process and, think about the message that's coming from the communication partner. So I would say that's the type of background noise we want to avoid. Yeah. So then another way to communicate, more effectively with people who have hearing impairment is to make sure that they are also having good eye contact with you. So one of the things that people with hearing impairment can become quite good at is speech reading. And so having them watch your lips and, get that visual cue of what you're saying can really be helpful. That's one of the tips in there that I didn't talk about, but that can be really helpful with people who have hearing impairment.
I'm looking to see if there are any more. Let's see. No, I think that's it. So thank you so much, Dr. Rodriguez, for your information and for taking the time to speak with our audience. So far, we've had over 180 plus people who've signed in.
Yeah, that's wonderful. Thanks for having me. It was a pleasure.
Okay. There are some people who are asking about how to get into the next session, and the community, the CEP Live link has been put into the chat by Ms. Danzy, and it's bit.ly/CEP Live webinar. B as in boy, it.ly/CEP Live webinar. And that should help. I think Megan is on, and Megan, you can talk about the session, even though I've introduced it, but you may discuss it further.
Absolutely. Thank you, Dr. Parker. Amy mentioned that every week we host sessions from the providers at CEP. And we have the most amazing occupational therapy team that really leads a program that all is about how do we live independently and safely in our homes as long as possible. And one of the things that's been coming up over and over again, especially with the holiday season coming up for our OT team, is how do we stay safe? How do we avoid scams? How do we protect our passwords and our devices a little bit more safely? And so if you want some really approachable, easy tips to sort of implement in your everyday life, in your home, to add that extra layer of protection, please join us for CEP Live today from 3 to 4 p.m. She'll be showing all of the tips. We'll record the session and post it later on YouTube so you can have all those available at your fingertips. So we'll drop that link into the chat one more time. We'd love to have you all if you'd be interested in joining today. Thank you, Dr. Parker. Thank you, Dr. Rodriguez.
With that, everybody, that concludes our program for today. We look forward to seeing you next week. That's the first day of November. We'll have a great presentation. We look forward to seeing you then. As again, all of our programs are being archived on our YouTube channel. Ms. Zanzi has put the YouTube channel link into the chat. And no, we won't be saving our chats for general consumption. So if you want to be a part of our programs or listen to our programs, we have them archived on a YouTube channel. Our real push and interest is to get you engaged in some clinical research here at the Goizueta Alzheimer's Disease Research Center. The Cognitive Empowerment Program is another way. It is a form of research, even though it does provide something of a service. So people there are also actively participating in research. So we encourage you to find a research study that you would be interested in and committed to, and please participate. I want you to be in clinical research somewhere. I think you get better health, you become more knowledgeable as a patient, and you get better at taking care of yourself when you participate in clinical research. So we'll look forward to seeing you next week. With that, I will say goodbye. Thank you.